এই সামনে না দাদা সামনে না
সরে যা একটু বিটু
দাদা সামনে না দাদা
আরে ছেড়ে দেন এত ছবি লাগবে না আমাদের কিছু ছবি লাগবে না আমার কি করতে হ্যালো হ্যাঁ আমি ICMR হ্যাঁ করে তো
আগে আসবেন কি বলবো আমি তো ওদিকটা চলে যাচ্ছি
সাইডে
তো বুঝেও তো বললাম ছবি পাঠাবে
স্যার একটু স্যার
and privileged to welcome Dr. Rajiv, Honorable Secretary, Department of Health Research and DG, Indian Council of Medical Research, Honorable Principal Secretary of the Department of Health and Family Welfare, Government of West Bengal, Dr. Narayan, eminent personalities who had the opportunity to know Dr. Dilip Mahalanabis closely, representatives from the press and the colleagues of this institution. To this ceremony of unveiling the bust of Dr. Dilip Mahalanabis, Padma Vibhushan, who championed oral radiation therapy as a life-saving treatment for cholera more than anyone else in the world. It is a very special day for our institute, which carries the long legacy of research on cholera, and the staff and scientists of the institute who were awestruck by the simplicity, depth of knowledge and magnanimity of Dr. Mahalanabis, who remains a constant source of inspiration to us, and we feel proud to install his bust at our institute premises. I would now like to request Dr. Rajiv, Secretary, HR and DG ICMR, to kindly unveil the bust of Dr. Dilip.
দিদি একটু সরে আসবেন দিদি একটু সরে আসুন ম্যাডাম পিছিয়ে আসুন ম্যাডাম একটু পিছিয়ে আসুন ম্যাডাম বাচ্চাটা রাগ হয়ে যাচ্ছে
স্যার সামনে থেকে একটু সাইড, স্যার সামনে থেকে একটু সাইড। আরে সব দাঁড়িয়ে আছে স্যার। সামনে দেখে সামনে সাইড হয়ে যান না, দাঁড়িয়ে আছেন। দাদা সামনে থেকে পেছনে ক্যামেরা আছে।
Everything is photographed.
কিন্তু ঘুমটা অন করলাম। হ্যাঁ অন করে রাখলাম।
দাদা সামনে থেকে একটু সাইড দেবেন। আরে ওরা লাইটটা জ্বালিয়েছে না, ওদের ক্যামেরা এই জন্য।
ঠিক আছে।
দাদা একটু ক্যামেরা পেছনে করো না, সামনের দিকে ঢোকাচ্ছ কেন?
তাই তো জানি, তাই বলেছেন।
সামনে যে সব যাচ্ছে কিরকম?
ওই সামনে,
এই সামনে থেকে একটু ছাড়ো না ভাই,
পিসিটা করবেন না ওইখানে।
পেছনে আসো না, পেছনে 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 নিচে বসে যাও একটু। স্টিলের ফ্লাশটা আসছে ভাই, স্টিলের ফ্লাশটা আসছে।
রয়েছেন ICMR এর অধিকর্তা রাজীব বাহল থেকে শুরু করে শান্ত সবুজ দাস।
থ্যাংক ইউ
এই
স্যার।
ICMR এর নির্বির পূর্বাঞ্চলীয় অধিকর্তা রয়েছে, বিভিন্ন চিকিৎসক বৃদ্ধ।
হ্যাঁ এখানে হয়ে গেছে, বেরোচ্ছে স্যার এটা।
কিন্তু আয় এবং
বেরোচ্ছে নাও এটা। হ্যাঁ চেঞ্জ করো। হ্যাঁ ঠিক আছে, কাট করছি রেকর্ড।
না 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 বলার মুড়ি নেই, দেখি
Good morning, everybody. A warm welcome to all of you. Before starting the program, we have a high tea arrangement in the 5th floor. You can please join there. Thank you. Good morning, everybody. A warm welcome to all of you. Before starting the program, we have a high tea arrangement in the 5th floor. You can please join there. Thank you. Good afternoon to all respected dignitaries, distinguished guests, scientists, and staff members. On behalf of ICMR-NIRBI, I extend a very warm welcome to everyone present in this gathering. It is a matter of great privilege to assemble in this occasion and to remember Dr. Dilip Mahalanabis, a path-breaking scientist in oral rehydration therapy. As we begin this gathering, we are honored to have with us today our Secretary DHR, DG Sir, and other dignitaries whose leadership continues to shape the future. So we welcome all the dignitaries and distinguished guests. As we now commence the proceedings, I humbly request our Director Sir, ICMR-NIRBI, to deliver the welcome address. Whose leadership continues to shape the future. So we welcome all the dignitaries and distinguished guests. As we now commence the proceedings, I humbly request our Director Sir, ICMR-NIRBI, to deliver the welcome address.
Dr. Dilip Paul, Principal, BC Roy Postgraduate Institute of Children's in Kolkata. Other dignitaries present in the auditorium, our scientists, the staff of this institute, students and fellows. It's really a great pleasure and honor for us that we are commemorating the contribution of a stalwart scientist in the field of diarrheal diseases, Dr. Mahalanabis, Padma Vibhushan, and we are fortunate and extremely happy to install his bust here at our institute premises, and get that bust unveiled by none other than our DG ICMR, Dr. Rajiv Bahl. So on this occasion, we have invited several eminent personalities from West Bengal and other states who had the opportunity to work with Dr. Mahalanabis and know him personally, so that we get a flavor of the scientist and the human being that is Dr. Mahalanabis, who according to many of us is the finest human being that someone can encounter in their entire life. So without wasting any more time, I would request our DG sir to say his.
S. Reddy, Dr. Abhijit, Dr. S. Reddy, Dr. Abhijit, Dr. Panda, all the eminent guests, all the eminent guests. Tell you how I know him before I say something about him. He was one of the very, very close friends of Dr. M.K. Bahl, who I worked with, who was my mentor. So I worked with Dr. Bahl for 10 years, and every time Dr. Mahalanabis was in Delhi, Dr. Bahl made sure that we met with him, because he said he is one of the greatest physician scientists. You should interact with him, talk to him, understand his perspective. Then I went to WHO in Geneva and basically went to the same unit. I worked in the same unit, same department, where Dr. Mahalanabis had served for 5 years in the World Health Organization in Geneva. And I could also hear a lot of things that he had done there, people, how they remembered him, and how a physician scientist could become somebody who is an embodiment of both the best of medicine and the best of science. As was said by Dr. Das also, I totally concur with him. He was the gentlest, maybe one of the finest humans that you will come across. It didn't matter to him whether you were a young student, young professional. He would treat you like a brother, like a younger person that wanted, and he would always be very thoughtful and give you all the perspectives. So in a lot of ways, I learnt a lot from him. And if you all know what he did with the ORS, discovery of the ORS, even prior to that, when the only treatment available was intravenous fluids, and he said it is not going to be possible for me to treat these people. So he thought of how to do. So what is it that makes you a great scientist, a physician scientist? I think the first important thing is empathy. He could have said, okay, I will give IV fluids to how many people I can, and the rest I can't do anything about. What can I? Most people do that. But he didn't. He had that empathy, he had that touch that I must do something for my patients. I must do something for people that I care for. And that caring and empathy is at the core of being not only a good human being, but also being a good scientist. Until you feel that in your heart, that what you are working on, you may be working in a lab. But if you feel why, not that I'm doing it so I will get a paper published or but if you feel the pain of the person who is suffering from the disease that you are working on, the vaccine that you are working on, or the diagnostic you are working on, if you can feel that pain, that empathy towards that person, you will work differently. You will be much more successful than simply saying, I have to get a promotion after 5 years, so I need 5 papers. Those will come in any case. But empathy, I would say, was his number one thing that I saw. He was always empathetic. And it is not the only thing he did. In fact, simplified newborn care. I also give most of the credit when we was working with Dr. Arun Singh. A lot of that thinking of simplifying care, not complicating it, but making it simple. Learning from whatever we know globally. At that time we had learned, he said, but Vietnam can do it, why can't we do it? We will try it out with the Purulia model. And it made such a big difference. There are now 850 plus SNCUs in India. That contribution has not been recognized. But a lot of that credit also goes to Dr. Dilip Mahalanabis. So when you mix clinical acumen with scientific knowledge, why did he mix glucose and salt and not something else? He must have had a very good understanding, and he did, of physiology, of what is really required, how do you do what you do. And this is one example where I would say was first in the world, because the whole world learned from us. The whole world learned from Bengal that how to treat diarrhea. And that makes us all very, very proud of the work that he did and the work that led to saving so many lives. But also now ORS is the standard of care. Nobody will start with IV fluid. It's a standard of care for everybody across the world. It means that what you may think as an opportunity at that time, only because it was a last-ditch effort and last resort, actually became the standard of care because it had scientific merit. And it is, if you would have just used it once and nothing happened, it would not have gone anywhere. You have to take it forward, you have to do adequate research, prove that it is effective, prove that why, what are the mechanisms, how does this happen. And he contributed to a lot of that thinking, a lot of that work while he was in India, while he was at WHO, when he came back. That is immensely useful. So turning an opportunity to think with empathy, with clinical acumen and scientific knowledge and thinking, and then converting, bringing simplicity, easy, not more difficult solution, which becomes the standard of care. You cannot think of a better story. You cannot think of a better contribution to humanity that Dr. Mahalanabis provided. I also am really very happy because I was further involved with him because of the NGO that he created, the Society for Applied Studies. And we worked with that when I was at WHO for 20 years. It is one of the finest examples of non-government research organization that has been set up. And all that legacy belongs to Dr. Mahalanabis. And I was extremely proud in WHO when we were looking at it. This type of organization competed with London School of Hygiene and Tropical Medicine and Johns Hopkins University, and they actually performed better quality work than was being done by those institutions. Because one advantage of being at global level is that you can see and benchmark what institutions are doing. So it was one of the finest. India has in maternal newborn child health, at least 5 institutions that I would have called better than any in the world where research is possible. So this is one of those organizations. So I am really very, very proud of being associated, having had immensely long discussions over dinners, over tea, over working through day-long meetings, thinking about the Society for Applied Studies, what should be done, how should it be done, etc. with him. And think that today we have honored him, and the Indian Council of Medical Research, NIRBI, have put this bust alongside another great scientist. To me, this is immense joy and immense pride. Thank you. Jai Hind.
Thank you, sir, for your inspiring and insightful address. Your words will continue to motivate us to pursue excellency in biomedical research, and we will definitely remember the word empathy while doing our work. So now we move on to a very special occasion of today's program, remembering the life and scientific legacy of Dr. Dilip Mahalanabis, a humble scientist whose path-breaking contributions have left an enduring impact on biomedical research. This session is an opportunity to reflect upon a life dedicated to science, mentorship, and service to society. To share their memories, reflections, and experiences, I now have the honor to invite our respected speakers one by one to say a few words in memory of Dr. Mahalanabis. First, I have the honor of inviting Dr. D.C.S. Reddy, former Professor, Community Medicine, Banaras Hindu University, to share his reflections. Thank you.
Dr. Bahl, Secretary, Department of Health Research and Director General, Indian Council of Medical Research. Dr. Das, Director NIRBI, and distinguished guests and colleagues and friends. I personally consider it's a proud moment to me, not only to me, to all of us, to be associated with this occasion. That's because the first thing is the bust is being installed and unveiled here in what I call as erstwhile NICED. And the association of Dr. Mahalanabis with NICED is so intense and deep and so long. I myself became the scientific advisory committee member of this institution in Dr. S.C. Pahl's time in 1989. By that time, he was already there and he continued to be there. I probably left in 2015 as scientific advisory committee member, and he continued there also. So altogether, I had an association of about 25 years or a little over 25 years with Dr. Mahalanabis. Of course, my association with him is purely professional and during these meetings, and we also used to meet on few other occasions, like during, say, evaluation of incline, these kind of things. Now, what is important here is, first of all, when I first met him in 1989 in Dr. S.C. Pahl's laboratory, and Dr. Pahl introduced me to him. He was at that time working probably in WHO. In 1989, I think he was in WHO. I was visualizing a person, different person. Why? I shall tell you the background. I was teaching in Banaras in the university. We have a tradition of, in the beginning, we talk about the eminent scientists of the world, particularly public health scientists. Now, in this context, I am treating Dr. Mahalanabis as a public contributor to public health, right? So we used to have lectures, and two figures from the state who used to figure in those lectures is, one is Seal and this thing, one more person who did epidemic dropsy. The second is Dr. Mahalanabis. We used to teach about him, what great contributions they have done to public health. So here I am being introduced to a man who has repeatedly appeared in my lectures to the students. And I had a virtual image, mental image, imagined personality within my mind. I was imagining a big person, serious, probably condescending upon others. But then, lo and behold, what did I see? I was bigger, and he was actually relatively this thing. And most important thing is, as you were mentioning, he was smiling. And that smile, let me tell you, from 1989 to 2015, when I met him last, it never disappeared. I was wondering how he could maintain that smile at any time and any given moment. He used to be very smiling and very warm towards you, very kind and warm. Though despite his stature, he used to make you feel we are in the same club. That's one great thing about him. Now, we used to go and sit in these meetings, scientific advisory committee meetings. He was actually focal person for clinical studies, and I was the primary discussant for epidemiological and public health studies. But the moment epidemiological and public health studies are taken up, he would come and sit next to me. Not only sit next to me, he used to be very keen, very critically observe all these things and keep whispering in my ear. He used to endorse my comments or add some suggestions to these things. And he used to give his comments unfiltered. He never used to shed. But the capacity he had, which I still aspire to imbibe from him, is the bitterest comment he will put across in such a mild and pleasant way that you would enjoy hearing that criticism or comment from him, and which is a skill in 25 years I could not actually muster. I'm telling you, though I could appreciate it, I could not actually muster that thing. Now, something more used to happen. As you were saying, like during dinners, etc., we used to have lunch breaks, and every day the tradition of this particular institute is on the first evening of the first day of the scientific advisory committee, we used to have a banquet kind of thing. And he used to come from the city. He used to go and sit for some time with Dr. Martin, some time with me. And he used to spend about half an hour on that day particularly. And he used to talk about many things. And he was, in that particular meeting, every time, he used to inquire about how we are actually building the capacities of people in epidemiology and research methodology at medical college level. He used to talk about what kind of impact this India Clan and INCLIN are making. And he used to talk about that SAS, and even he invited me once to go there. Probably I was traveling abroad and therefore I could not make it, and I did not have any subsequent invitations. So he was always very, though he is a pediatrician and great proponent of these things, all those initiatives that you have talked about, he also had a affinity for public health as well as epidemiology. Now, there is one more thing that when I talk about this thing, I used to keenly observe what kind of studies he used to actually like. This was one thing. When you sit together, you try to see who likes what. And his affinity was for, once again, the studies, even within this. You see, we all talk about the physiology and understanding of physiology. There is one more thing I observed even with that Nandgaon experiment. The additional thing he did was, he made it accessible or that it can be practiced at the most peripheral level. He trained community level workers, and he made other people. This institute trained community level workers and even communities. That means, apart from the physiology, his focus was on making your remedy or intervention accessible to people, usable by people. That is some very critical input that he provided, which we forget. In fact, in many of the subsequent public health programs, they imbibed and adopted this thing. And not only that, he used to sometimes during these discussions, he used to tell us, do you know, Reddy, we have to basically look at, when you try to evaluate a project, it is important what kind of relevance for the population it has. He used to say that. I would place primary criterion to think a project should be funded is how relevant it is. You should be able to address what good is it going to do to the people. That's number one. And second comes the methodology. Methodology can be adopted a little bit even if it goes. But you cannot really compromise with the objective, and that objective should be one which is going to do good to the population. This is another thing I learned from him. Then, there is, of course, his life and work, as described by Dr. Bahl, is something, it's a lesson for everybody, and it was a lesson for me. In fact, though we were sitting equally on the, scientific advisory committee members, I always used to feel there is always, every time I meet him, there is a new thing to learn from kind of thing. But most important thing is his personality. What he used to make me feel is, he has simplicity, which is unparalleled. He has dedication to service. This is what some empathy he was talking about. Take it further, it is dedication to serving the people. That is the second aspect. Idea sharing. He never used to hold back. If he has a new idea, he readily, when we take up a topic, his ideas immediately he used to give it to you. This is another very good attribute of Dr. Mahalanabis. And one more thing is, people don't often mention this thing, but he mentioned it to me, that's why I'm interpreting it in my own way, is courage. Courage is something people don't talk about. Why do I say this courage? He once told me in some context, Reddy, don't think that anything you try to do, you will always have obstacles, right? And he said, when I was doing this Nandgaon study, there were many people who were skeptics about what I was doing, whether it is succeed or not, is it going to do harm or not, this kind of thing. But what is important is, your clear understanding of the problem, and your conviction. If you have conviction and pursue with that, these obstacles can be overcome. I interpret it as courage to have that conviction. That's why I'm using the word. One of his virtues is the courage. Though you don't really associate courage with a simple, petite person, but I see courage in whatever he did. That's how he could go forth. And there is one thing. When you say unveil or install a bust in a particular institution, first thing you see is a beautiful, very good sculptor. He has made a very good sculpture. But to me, it's not only sculpture. Sculpture is, of course, when you do, you have several attributes about everything. Good sculpture is one attribute. We don't deny that. But more important, the future generations walk past that bust. They should remember what he has done. Something should be done. And it should inspire them to develop a similar personality and a desire to do the same way for future. That's all I have to say. Thank you very much, Dr. Das, for inviting me. And it is such a wonderful feeling to be here to think about a person with whom I was associated for a quarter century of my life. Thank you very much.
Thank you very much, sir, for your thoughtful words and revealing the memories that you have. Next, I invite Dr. Shamiran Panda, former Additional Director General ICMR and also former scientist of ICMR-NIRBI, to share his memories. Thank you.
Good afternoon. Dr. Bahl, DG ICMR, Dr. Santosha Bujdas, Dr. Reddy, and Dr. Karnango, Dr. Chaudhary, and many of the dignitaries here present in this room. While I was coming to the podium, Dr. Nobindu Chatterjee, who is a dear friend of mine and then a colleague, whispered in my ear that you have 3 minutes or 3 to 4 minutes. And that immediately brought in my mind something that I read in my school days. There was a small little piece written by Haraprasad Shastri, and he was writing a piece which ran into 2 to 3 pages of a typical school textbook on Ishwar Chandra Vidyasagar. And why it popped up in my mind? Because all of us know what does a microscope do. It expands in a small thing, it enlarges the view in order to understand things better, and I'm supposed to do exactly the converse of it. A big person like Dr. Dilip Mahalanabis needs to be encapsulated within 3 to 4 minutes. I would rather not do that. But that's exactly the tough job, you know, a person. And I'm, of course, grateful to Dr. Bahl, who has captured, you know, his experiences and understanding about Dr. Mahalanabis' work, Dr. Santosha Bujdas, and Dr. Reddy. So while I was requested to reflect upon my experience, I have really been fortunate, I would say, to be able to spend formal and informal times with him. But, and it's a momentous occasion today, indeed, this unveiling of the bust, and people are thinking of his work and trying to see what they could draw upon, all those. But any good things would always have some, of course, beautiful, pleasurable moments, but there are painful moments as well. So I will talk about the painful moments first and end with the pleasurable moments. The pain was what I experienced in 2022. You have Dr. Abhijit Chaudhary sitting here. He took an initiative and he attempted to bring out a book called Lights of 100 Stars. This is the book in Bengali. It talks about a little more than 100 illustrious physicians and scientists. And there, only 12 persons in this book, which had 100 in it, did not have a mention of the year of passing because they were still alive. So Dr. Dilip Mahalanabis' chapter in this book had 1934, that's the year when he was born, and then there was, the other part was not there because he was still alive, and that was, this particular book was launched by the Nobel laureate, Abhijit Vinayak Bandyopadhyay, the economist. All of you are aware of it. And the 9A Ho Chi Minh Sarani, there in Calcutta, there is this Indian Council for Cultural Relations, ICCR, where it was launched. Abhijit Vinayak Bandyopadhyay was doing it. And in that particular, in this particular book, there were 12 people, and then after, that was July, 19th July 2022. And after 3 months, the other half, which was not there, came right in front of us. After 3 months, so that was July, and in October 1922, he passed away. But even before that, when I was working at the ICMR headquarters, I called him up in order to request that, why don't you help some of the scientists, because they really need your guidance, because you won't believe his help. He used to tell a very, use a different phrase, creating opportunities for people. That's what he was doing. And that creation spanned from scientist B or C to the director. I'm not going to name the directors, but the directors who got an opportunity, even in WHO, was helped by Dr. Mahalanabis. At the same time, he is sitting with the scientist B or C in order to, say things or do things which might help them understand some of the concepts. But when I called him up from the headquarters, I started realizing that his memories were not the way it used to be. And the most painful situation was, he told that, Samiran, I cannot even remember my own work. And that's the pain, you see. He's the creator, he's the researcher, he did path-breaking work, and he's telling me. And then I said, what does the investigation say? He would, the most beautiful thing about him is that even if it is about his own health, he would laugh on himself. I will tell you the example of that. But that time he said, I think that the investigation is showing that my brain is shrinking. And then he started laughing. I said, okay, but if I have that capacity of that shrunk brain, I will be so, blessed. And so we used to crack jokes, etc. But that was the painful moment when I realized that he was sort of finding it difficult to remember things. And then when Abhijit requested me, I call Abhijit because he's a friend of mine. So when Abhijit requested me, I actually visited him at his place. That was April, Bengali New Year. And then I could see that its images coming, and those are like collages in his mind, but they are not getting coherent. I will go to the pleasurable part now, because that's a painful moment, when people cannot remember. So Mark Twain once said that, one of his friends entered his room and said, hey, you have a fantastic collection of books, like huge collection of books, but all the books were lying on the floor. And this friend asks him, hey, what is this? These are so good books. You should keep them properly arranged on the shelves. He said, of course, I should have kept them. But all these books, the way they came to me is by borrowing and not returning. But nobody, are ready to give me shelves. So people were ready to give him the lend books, which he never returned. So there was this huge collection, but people never, the lend shelves. So, but I was fortunate. Dr. Dilip Mahalanabis and I used to crack these kind of jokes amongst ourselves. But I was fortunate to get some of the books, although we realized that books go out and never come back. Okay? So this is one of the books. Why am I telling this? And it has he was actually given this. This particular book is about Queen Elizabeth Hospital for Children. That's in the eastern part of London. And on the page 84, and this book I got when the book not only collected some dust, that was the New Year I was referring to, the Bengali New Year, but the dust also got collected on his memories, so he could not. But this book was there. He said, take it. You want to know about some of the references of the work? So I took it, and it's there with me. And there are a few more. On one, he would just photocopy a chapter and would write, to Dr. Panda for burning some midnight oil. I knew very well that he was burning midnight oils as well at that age when he was giving it to me. So it was quite inspiring, the inspiration that Dr. Reddy was talking about. This is one of the examples. I flipped through this book. On page 84, I saw a mention of two persons. Two. The ex-student of this, you call it ex-student or researcher, physician who were associated with this college. Page 84 says that two, one is a lady, Cecily Williams, who worked in Ghana on malnutrition. And the other person's name is Dr. Dilip Mahalanabis. Both of them worked in developing countries, but the outcome of the work benefited not the people only in the developing countries, but all over the world. That's how it refers to Dr. Mahalanabis' work. Now I will end with 3 sentences that I learned from him. But before I go to those 3 sentences, I asked him, I was able to ask that kind of questions because as Dr. Reddy said, he would treat me as his friend and he used to laugh on himself. That's what I liked. I said, sir, tell me one thing. There is nobody in this room, so you need not to get worried. I am not going to divulge this secret that I am going to ask you, okay? He said, yeah, tell me. Sir, how is it possible for you to capture and express so beautifully whatever you want to express? Just tell me the trick. I want to pick it up. He said, who actually came to know about my abilities? I said, who? Oh, that school teacher in Bangladesh, where he was born. There was this, in Sanskrit, it's bhava samprasaran. Like you are given a small little sentence and you have to expand it. So he did his samprasaran, expansion of the idea. He submitted his copybook to the teacher, and that teacher used only 3 words. I'll say in Bengali and I will translate it in English. He said, you know what my teacher wrote? The margin, on the margin of that? I said, what? Chintar doinno susposto. I will say in English, and in English I require 4 words, not 3. You see, it was so beautifully captured. Paucity of thinking evident. That was the comment of the school teacher. And then he said, since then, I thought, no, I have to pick it up. I have to learn. And I'm still trying, Samiran, I have not. I said, wow. So this man had no qualms of saying, hey, I'm a person on which there are a whole lot of elements to laugh about. And that's what he used to do. I am invited by ICMR, Dr. Bahl knows, and I go to places to teach people. Frequently, I have to use one particular sentence that I picked up from him. Because many of the scientists, researchers, young, mid-level, senior, doesn't matter. Sometimes they're very aversive to keep notes or write things, even for data. I'm talking about the qualitative research. Dr. Dilip Mahalanabis used to use a phrase, a short pencil is better than a long memory. And I would make my trainees repeat this. That's sentence 1. Why 3 sentences, you can ask, because I'm coming to the end of my remembrance or remembering him. Because one of my journalist friends told me that never speak beyond 3 points, okay? Because after that, nobody is going to listen to you. So that's why 3. So 3 is my favorite number. So this is one sentence that I use in my training sessions. And then in some of the evenings, as I said, like informal meetings, and we would tell respective family members that we have a meeting over dinner. That's actually exploration of a food joint. And he would tell me to go first do a Reiki so that we can go or not. So of course there were, the restaurants which I would go to Shialda station, that's a big railway station, and I would say, sir, this is a risky proposition. He said, okay, that's the whole purpose of observation. Let's go to Park Street. So you'd go to Park Street. In one of those evenings, he said, Shamiran, remember, there is nothing as pleasurable in life as interacting with a fine mind. That's the second sentence. And he referred to Dr. V. Ramalingaswamy. And they used to call him Rama. And V. Ramalingaswamy used to visit ICMR-NIRBI in Bangladesh. And he said, Rama would come to the dinner and would have interactions, chats, food and drink, everything. But he would always carry a little book and he would present that to me. So that's his anchor point. So that's the second. The last and my concluding sentence that I picked up from him would be something that he kept written on the blackboard. He was very fond of keeping a blackboard and a chalk, the bold, but he quickly picked up the new technologies, and that time computerized data analysis and computerization was coming in a big way, early 90s, but he kept something written and it remained there forever. And that is apparently, you never know these days whether Albert Einstein really said this or not. Because my desk, my table, even today, if you go to the place where I stay, half of the bed is occupied by books, and the rest I sleep. If a cluttered desk is a sign of cluttered mind, what is an empty desk a sign of? And he kept it written. And then his wife used to visit sometimes. He would look at him, he would look at me. She knew. She would look at us, and she would look at the blackboard, and she would go out. And she would not, but she realized that, okay, this table is not going to change in its appearance. Neither this man is going to leave Dr. Mahalanabis's room, and Dr. Mahalanabis should be, talking something which they won't divulge to me. So she used to go out. But thank you very much for inviting me and giving me this opportunity to remember some of the things which is no way capturing the Dr. Dilip Mahalanabis in its entirety, be it his work or be it his personality. But yes, I do have books, but not the way Mark Twain used to get it. So I have 2 or 3. I'm really lucky. Lucky in the sense, not just getting the books from him, but being able to spend time with him and these exchanges that happened, which will remain with me forever until so long I'm here on this planet. Thank you very much.
Thank you, sir, for your valuable insights and remembrance. Now I invite Dr. S. Bishai, Associate Professor, Sidho Kanu Bishai University, to share his reflections.
Respected Dr. Bahl, DG, Secretary DG, DHR and DG ICMR, Director Sir, Dr. Santa Sobuj Das, and other dignitaries. Especially I mentioned here that Dr. Samiran Panda and Dr. Samiran Visai, both of them working in a Society for Applied Studies since 22nd March 1999. So it's a great honor for me that both of them are present here to remembering Dr. Mahalanabis. Just 2-3 points I mentioned here, because there is a long way, near about 28 years past since I joining in the Society for Applied Studies and doing my PhD, which was basically designed by Dr. Mahalanabis and give me the opportunity to work under him. And he has lots of knowledge in anthropology, because I am coming from not the medical subjects, basically biological anthropology. And he has lots of knowledge, particularly the body composition, human variation, anthropometry. And he always told us that you do something and love data, and always calculate the Z-score, SD scores for child growth, and give us 2-3 proposals. When I start my work in Pelagata ID hospitals, vitamin E and C on measles, my first project. Then Helicobacter pylori on iron supplementation, and many others. And then I go to the MR Bangur Hospital, Taliganj, cephalaxin and metronidazole in second trimester of pregnancy, which is related to my PhD work. And then I start iron zinc supplementation on child growth, particularly low birth weight babies in South Calcutta. That time, he always told me that do something for the weaker section of the people. And then I designed a proposal for health and nutrition status of the Santal children. Basically, they are the largest population, tribal community in West Bengal, nearly about 50%. And I shifted to Vidyasagar University, and he always give me opportunity to work in the entire project. And my first publication, he gave me the opportunity as an author, published in Health, Population and Nutrition, published by ICMR-NIRBI. And think as a supervisor, he insisted on scientific rigor, clarity of thinking, and honesty of data interpretation. And most important thing, sir mentioned that the methodology. He always used to calculate pen and paper. I remember the one equations for calculation of sample size, which is used in my PhD, that the SD square divided by worthwhile differences into 7.9 in 2002. So that sample size calculation, he calculated based on the pilot data on that time by pen and paper, which I used in my PhD also. So this is the situations. And on a personal level, I remember Dr. Mahalanabis, a gentle, compassion being humble, compassionate human being despite his international stature. He lived simply and interacted with students and field worker, nurses with equal respect. He never sought recognition, dissatisfaction comes, and his satisfaction comes from seeing evidence translated into life saved. For me, Dr. Mahalanabis will remain more than a legacy, legendary scientist legacy, and he will remain my teacher and my supervisor. Thank you all.
Thank you, sir, for your kind words. Next, I invite Dr. D. Paul, Principal, B.C. Roy, to share his reflections.
Respected Dr. Bahl, Director, and I said, NIRBI rather, and Dr. Reddy and other dignitaries, Somiran is there, both Somirans are there. I had a wonderful opportunity to work with Dr. Dilip Mahalanabis since 1996 when I was Mayor RMO in Dr. B.C. Rai Postgraduate Institute. Presently, I am working as a principal. So, his works, not only the diarrhea, but pneumonia, role of zinc, role of antioxidant, and malnutrition, malnourished children should be dietary supplementation. Apart from his work on newborn care, as mentioned, Dr. Odin Singh is my friend, and Dr. Amitabh Sen as mentor in this regard, who was a renowned pediatrician. We have lost both of us, sir. So I was there with him till his death on October 22, and posthumously he awarded the prize, the Padma Vibhushan. But before that, in 2002, he received the award Pauline Prize, which is equivalent to a Nobel Prize in Pediatrics. And he also received the Thailand award, highest award. So I am very happy to be here in this occasion. I must thank the Director NIRBI for asking me to be present here. Thank you, sir.
Thank you, sir, for your insightful words. Now I invite Dr. S. Kanungo, Director, RMRC Dibrugarh, to give some impact.
Good afternoon, sir, and good afternoon, the dignitaries. What but I will say that when I joined this institute as a project scientist in 2002, he picked me up. Because at that time, a lot of international projects were coming, and he was coordinating and was the principal investigator on oral cholera vaccine. So he picked me up, and he from day one started, I mean, I was very raw at that time, even still now, but he started teaching me. And not only that, we used to do studies together. He used to vaccinate. Dosing. Then I asked him, sir, why you are dosing? There are so many people are there, project staff and all that. So what he said, Shravan, learn one thing in clinical trial, right people, right dose. This is the first thing. Anything you can change later on, but this one, if you do it wrong and your surveillance, then whole study is gone. If there is a miss in the, say, informed consent thing, also documentation, so all these things. Not only that, he taught me, by hand, the analysis and everything. He was my SAC and ethics committee member. So whenever I developed some project, I used to go him first to show him everything, every time. Even he is not involved in any of the projects. The last thing that we did together is a very important study funded by DBT, Department of Biotechnology, the oral cholera vaccine VA 1.4 study. Is vaccine between 1.4, 1.3 was there, but in 1.4, there is a ampicillin cassette was removed, and he was the main thing, along with Professor Amit Ghosh. So he asked me, Dr. Nair asked me to work with him. He was the then director of this one, and he asked me to develop the proposal. So it was safety and immunogenicity. So I did that, and we have to pitch the project in Department of Biotechnology. So he took me to Delhi. So they were all big, big scientists were here at that time, but I was scientist C at that time. He said, no, you come with me. So I went with him, and when I entered the room, I saw Professor Bahl was sitting. So I have to present the project in front of him. So I said, sir, sir, you present it. Well, no, I am sitting there, you present it. If anything, I am there. But presenting this is at scientist C level, like in front of the king, and Professor Mahalanabis and Dr. Amit Ghosh. I started presenting the thing. Dr. Bahl said, that means you have got 10 minutes, and we have to pitch it. Otherwise, I will ask Dr. Mahalanabis. So I could do that, and we got the project ultimately. Then in the airport, I said, I was, complaining him, sir, you should have told me earlier. So he told me, if I tell you earlier, you would not have come. So that's why, not only that, as Dr. Panda said, sir, he gave me many books, and I did not return them. Like Pocock's statistics, it is not available now. Fisher's original book, how to do that. He taught me in the blackboard, the famous blackboard, he used to write it, and it teach me, even in the evening, in the morning. Later on, he used to sleep in the afternoon. So I used to call him and say, sir, in the afternoon you will take rest, I'll come in the evening or in the morning. He used to say, no, come in the afternoon. So in the ground floor, from whenever I go, from first floor, he used to come and he used to write, do the analysis. Now we used to write programs. I was used Tata and then the programs, whereas I don't like programs. So I will give you these things. Everything he taught me through this. And responsibly writing the project, rotavirus vaccine interchangeability study. So when I wrote the project, he was in the committee expert to criticize this. I went to him. So he designed it properly. He told me that whenever, alpha is the type 1 error that we used to take. So 6 arms, it should be alpha by 6. So it went up. My sample size was, just a little technical. It was 600 something. When he calculated, it became 1,990. So I said, sir, could it be no? This is the thing, how you should do it. And we could publish that in Lancet ID. And I sent him the paper. He was so happy. I mean, said, see, I told you. And not only that, one thing I learned later on from my current DG, which is renunciation. I mean, which means in Bengali it is called let it go or sadhuta. So he is the living example which I have seen. This what I learned from my current DG, but when he was talking to us in front of an SMT or something, then I could just one person, if I was thinking about, that is him. I mean, he let it go. When we made that top project that was talking about, when I wrote the first draft and given it to him, he decided who will be the first author. Because I was scientist C at that level, and it was a policy paper, almost VA 1.4. It's a Department of Biotechnology funded, which is indigenous cholera vaccine. He said that he should be the first author. Dr. Nair also agreed, yes, right. So these things, a few things I learned from him, and he's like not almost, it's a father figure and father to me. I mean, whenever, if I feel down, I used to call him, and to tell you, he asked me to join SAS one time, but I said, sir, I'm from a middle class family, leaving the job and joining SAS, it's a bit uncertain. He said, no, if you think, I never worked for government, so I could survive at these 75, 78. So you people should try to get out of your comfort zone. He was a perfect teacher also. He never, as everybody said, whether it's a scientist B or say research officer, senior research officer, young, old, he never really cared. And I've never seen such an humble person, humble and simple person, and very humorous person. I have got very, good moments, private moments with him, and it's so happy. I was just wondering, I would end, one minute, just, I was just thinking that if he see his bust putting out in NICED, he would have loved what people you are doing. So he would have, feel ashamed that what are you doing? So with these few words, thank you very much.
Thank you, sir, for your insightful words. Now I would request Dr. Abhijit Chaudhary, Liver Foundation of India, Kolkata, and former professor, SSKM Hospital, to please say a few words.
Good afternoon to all of you, respected and honorable Dr. Bahl, the Secretary, DHR, Professor Reddy, Shomiron, and all of you who are sitting here. Remembrance is very frequently rejuvenation. So, to be very frank, when Shanto, a long-time friend, called me up to let this information float, I thought it's a great opportunity and privilege. I didn't have the courage and opportunity to be close to Dr. Mahalanabis. Why I say courage? Let me tell you, the way I saw the person, not very close, but with depth of feelings in my heart, and I used to see him somebody whom I would have loved to become. I mean, you need to have idols in front of you, and we in India, doctors, are trained, I'm very sorry to point out, to be prescribers. We are told that, you do research only for the purpose of putting your name to get promotions and some papers. So somewhere in my life, I felt that part of life does not really excite me. So I was looking for options and opportunities around, and I had the fortune of chance to come across a person named Bahl here, whom I owe everything in life, in research, little research that I could do. And then one fine morning, Bahl told me that, come and I'll get you introduced to a person in this, and so I heard the name, and I was reeling in and shivering in excitement. this comes this man. And I had an idea, let me tell you, that of training informal providers, which I keep on training even today. So I was looking for getting guidance from somebody, whether that's, it's a health system research, whether that's something that one should undertake or not. So, I put forth before Dr. Mahalanabis that, this is the idea. So, as I saw him, through interactions that I had, he used to listen more than talk. And he had the waves of Atlantic and the depth of Pacific together in the same body. So he listened to me, and then he told, it's good to be enthusiastic. It's even more important to be organized. You are going to face, as Professor Reddy rightly pointed out, you are going to face tremendous obstacles. You should have the courage to do this. You should have your research question very well formed. And you should have a methodology which also you have got in hand to address that. And these very words got me to be very frank, gave me lots. And subsequently, I had several interactions with him. And each of those were really from, when you meet somebody whom you adore, you respect more than anybody down on the sun, you don't feel like, for me, he was something like that, it's like Godish. So, it was there. So, when in the morning, Dr. Bahl was, unveiling the bust and everything, and then he went and garlanded the other person's statue. I'm just placing, I was singing within myself, Aguner Poroshmoni Chuao Prane. Let the fire touch all of us. He had fire. And one more person also appeared in my mind, let me tell you. And in fact, I'm somehow, infatuated with the thought of oral rehydration and research history. So I had been interacting with people, and one of the reasons I'm coming here is to get pearls from lives of this, hearing from persons like Dr. Bahl, Shumon and Shomiron. I keep on interacting. 3 persons, as I see, made this, one of the best discoveries of mankind together. It's Esande, who is smiling there, looking at Dilip Mahalanabis, that you join me here. And one person, again, I would just mention to you, his name is Dhiman Borua. And let me tell you that, it's like Amar Akbar Anthony in oral rehydration research. And I was just thinking that person is just blessing these 2 persons. That you are fortunate, your bus is there, and I'm sure I'm going to find my place somewhere. And I put this in everybody's mind that person took the light of fire and took this all round the world. He spoke to Habdan Mahalar, who was the then DG WHO, as I go through the history, and packed the oral rehydration in plastic, took that to Africa, took that all over the world. And that's how oral rehydration, the science was neat by Shambhu De. The example and the translation and the example before the world was set by Dilip Mahalanabis, kept on fighting. The 2 together met Dhiman Borua, or Dhiman Borua came jumping onto them, took the fire and took this all over the world. So that's how science is built. It's not I, it's we. What science does. Science done by an individual is possibly not the way science should happen. It's collaborations, and this again, Esande, Dilip Mahalanabis and Dhiman Borua in symphony. It's like Beatles, which was formed, and we get the dividend of that. That's one of the greatest of the scientific discoveries that has happened. And I'm really fortunate. I'm grateful to all of you to tell us so many stories. Dr. Bahl, Shuman, and everybody, Dr. Reddy. So that's how we remember. But again, I'm telling you, I'm privileged to Shanto and all of you for this opportunity. And we remain ignited every day in the flame that Dr. Dilip Mahalanabis gave us, and let's promise today to the mankind that we will carry out this flame. Thank you.
Many thanks, sir, for your insightful words. Finally, I invite Dr. Bandana Sen, researcher, to share her reflections.
Hello. Respected Chief Guest, respected Director, ICMR-NIRBI, distinguished dignitaries, ladies and gentlemen. I had privilege today working with and under him for 25 years, from 1998 to 2022. So this long association, I came to him very closely. I know him. He was very good-minded man. He was not only a renowned scientist, he was a good ideal teacher and a dedicated physician, a loving father figure. Above all, he was a quietly a smile man, always laughing and smile all time. At first, I see him at 1998. He was not never angry. He corrected our mistake patiently. He leave them and politely. I gave him a good teacher and a respected scientist. Personally, he gave me a renowned scientist and a big scientist. During COVID-19 pandemic lockdown, he lived in alone and isolation with his wife. At 9th July 2021, his wife passing, and he lost a most public health, and he lost his 10. Thanking you.
Thank you, madam, for your heartfelt words. We sincerely thank all the speakers for their reflections and honoring the memory and contributions of the great scientist. As we come to the end of this session, we once again pay our deepest respect to the life and contributions of Dr. Dilip Mahalanabis. Before we conclude the program, it is time to acknowledge the efforts of all those who have made today's event possible. I now request Dr. N.S. Chatterjee, Scientist G, ICMR-NIRBI, to kindly deliver the vote of thanks.
Good afternoon to all of you. On this solemn and proud occasion of unveiling the bust of Padma Vibhushan Dr. Dilip Mahalanabis, I feel deeply honored to propose the vote of thanks. Today, it's a historic moment for ICMR-NIRBI. As we gather here as a prelude to our 64th Foundation Day, we pay tribute to a visionary physician-scientist whose pioneering work on oral rehydration therapy became a life-saving global solution and saved millions of lives across the world. I sincerely express our deepest gratitude to Dr. Rajiv Bahl sir, Secretary, Department of Health Research and DG ICMR, for gracing this occasion and for unveiling the bust of Dr. Mahalanabis. Sir, your presence has greatly honored our institute and strengthened us to continue excellence in public health research. And as always, it was a pleasure listening to sir. We are equally grateful to the Principal Secretary, Health, Government of West Bengal, Sri Nigam sir, for his gracious presence and encouragement. I extend my heartfelt thanks to the distinguished dignitaries who shared their memories for reflection on Dr. Mahalanabis and reminded us of the extraordinary contributions. Thank you all, sir and ma'am. All of your words have not only honored his legacy, but also inspired all of us, especially the young generation. I also sincerely thank our director for his leadership, guidance, and wholehearted support for organizing this event. My appreciation goes to all the members of organizing committee, especially Dr. Mamta and Dr. Sandipan, all colleagues, scientists, officers, staff, and support staff, and volunteers who have dedicated efforts, made that program fruitful. Behind every successful event stands a committed team, and today is no exception. Finally, I thank all the guests and friends for being with us and for sharing the moment of remembrance and pride. Let us carry forward the values of Dr. Mahalanabis stood for: compassion, scientific excellence, service to humanity. Thank you all.
With this, we come to the end of the session. Thank you very much.